The Congressional Budget Office saying that the new health care law could result in a reduction of 800,000 workers over the next decade. So what does that really mean for the economy? Joining us now, Republican consultant Tony Sayegh, Democratic strategist Christopher Hahn, who's a former aide to Senator Chuck Schumer. Guys, good to see you. Thanks for coming in. And this is why we pay attention to these congressional committee hearings, so that we can hear from people like Douglas Elmendorf, who is the CBO budget director, who said this the other day. Let's take a listen.
That means that if the reduction in the labor used was workers working the average number of hours in the economy and earning the average wage, that it would be a reduction of 800,000 workers.
Okay. Tony, what do you take away from that?
Well,
a little hard. You know, it's sort of bureaucratic speak, but what do you think the bottom line there is?
Well, the bottom line is that it's confirming what we've been saying all along, which is that this health care law is going to lead to a reduction of jobs. It's certainly not going to create any jobs. But frankly, Rick, this 800,000 he's talking about is the tip of the iceberg. I mean, we're not even discussing the jobs that are not going to be created by businesses because of the uncertainty. We're just talking about what's going to bleed out of the economy because of some incentive in this law for people not to work. This health care law now has a new unintended consequence, which is it's incentivizing people not working. I don't think we need that right now.
Well, Rick,
Christopher, is that what you took away from it?
I'm glad that Tony acknowledges what's really going on here. This bill's not costing jobs. The 800,000 jobs he talked about are people who otherwise wouldn't be working but for their need to have health insurance, including people like my dad, who took early retirement after 30 back-breaking years as a Teamster, took early retirement, but he was still too young to get Medicaid, so he had to go back and find another job to get him health insurance, to get him up to 65 where he can get that Medicaid insurance. That's a good thing that people don't have to worry about that. They'll have other things. And it will also open up the economy for people who need jobs, who need to work, who are still in that working years. Those jobs will be opened up, positions will be opened up, and in the end, it'll be good for the economy. But I also want to point out, I'm very happy that Republicans now respect the CBO so they can acknowledge that this health care bill is going to reduce the deficit in the long term. Thank you so much, Tony. Thank you, Congressman, because now you've given CBO
gentlemen,
all the credit.
In all fairness,
I know
political parties like to sort of cherry pick from polls and from reports, depending on what suits their needs at any given moment. But what about this idea, Tony, that this is a safety net for people like Christopher's dad, who had to go out and find another job just to sort of bridge the gap until Medicare kicked in?
Well, look, I'm going to read directly from the quote from this testimony. And by the way, I'm not giving credence to the CBO. I'm just reporting and analyzing what the director said, which is this legislation creates some incentives that affect the number of hours people can work. Essentially what it's saying is, in America today, we have a health care law that kind of gives you the chance not to work if you really don't feel like it. That's not a job creation program. But the reason I'm even not so concerned about these 800,000 jobs, as much as I am concerned about the 2,400 pages of this health care bill, is because that's where lie the new mandates, the new taxes, the new regulations, the new authority to the HHS to create more regulations on business that are not going to create jobs as a result of this health care bill. This is a problem. It confirms that the health care bill will kill jobs,
let me ask you about
that's
I
not
want
the
to talk
biggest
to Christopher
problem,
specifically about the idea of this unintended consequence that Tony mentioned a minute ago, this disincentive on the part of employers to provide health care because they can't afford it. That could keep people from hiring. We've heard that argument. It could cause employers to drop health care coverage for their employees because all of a sudden the workforce will have no choice but to go out and get it for themselves because of the mandate. And then there's this other disincentive of people, you know, who don't have to go out and find a job because they're going to get covered anyway. These disincentives, is that a real problem that maybe the Democrats didn't think about?
You know what? I know there's a lot of speculation, and the Republicans are trying to keep the fear alive of this bill now that it's starting to be implemented.
This is the reality, Chris.
And we're
this
seeing
is not fear.
We're seeing the real effects,
Tony,
we're seeing the real effects of this right now. And what we're seeing is people are starting to become happy with this bill. They're happy that they could keep their adult children on their health insurance. They're happy if they're senior citizens that they don't have to fall into the donut hole and they're getting money back. and businesses are adding jobs in this economy. That's the truth of what's going on right now. We could talk
That's
about what might
nonsense.
happen and try to
That's
scare the voters all we
nonsense.
want, Tony, but what's really happening right now is unemployment has gone down. It will continue to come down.
Yeah,
and this bill is starting to
people
be
have stopped
implemented
looking for
every day.
work,
More and
and
more
they're getting off
Americans
the unemployment
like what
rolls.
they see.
Tony, let me give you the last word here, because Christopher mentions
the
there
last
are
word
some
is
things
this.
about the healthcare law that polls show people do like. When are we going to hear from Republicans the ways that they plan to keep those parts in, like helping to cover for young college graduates who don't yet have health insurance from their jobs, helping people with pre-existing illnesses, the drug benefit, and all of that stuff?
There would have been no better reform of this healthcare system, and the Democrats could have done it because they controlled both houses of Congress and the president, than ending the stupid antitrust exemption for insurance companies, allow cross-state line competition over health reform, and that's where you have gotten a free market solution to this. But by the way, I'm glad that the Democrats don't think it's a big deal that through this healthcare bill, you have 800,000 people now who are going to not have to work and not have to pay taxes. How are we going to pay for the rest of the things?
800,000
the
people
Democrats
near
want?
retirement
Tony
and
saying the
single
president
moms,
says that
Tony,
he's
you
not
know
paying
president
taxes,
said he's
and
open
that's
to
what he
ideas
said.
that will improve this law. We'll see. Maybe the antitrust laws that you just talked about, Tony, one thing that he'll be willing to listen to. Gentlemen, thanks so much for coming in.
Thanks for
Thanks,
having us,
Rick.
Rick. Nice to be here.
And with Hasni